Welcome to Ready to Exhale, where we center Black women, their lived experiences, expertise, and rich stories. In each episode, we will gain a deeper understanding of what it takes to hold space for our own well-being. This is a brave space where you will be inspired to express your joy and live in the fullness of who you are. It's also a place where we are no longer waiting to exhale. So now, get ready to exhale and enjoy the show. All right. Well, we are in another episode of Ready to Exhale, the podcast. And I have a special guest today, my dear friend and sister, actually, my sister, Stella. And so I just want to kick off this episode with her. Telling you a little bit about herself and what she does. And yeah, just let's dive in. Stella, welcome to the show.
Well, Katara, thank you so much for having me. I'm so excited to be here. I am such a fan of your work, and it's just an honor to share this space with you. So a little bit about myself. I am an HIV primary care physician based in New York. And when I was young, I wanted to be a doctor. I knew I wanted to be a doctor like my mom. What I didn't know is that the healthcare system is deeply, deeply broken. And so a lot of the work that I do now really thinks about how we offer improvements in healthcare, especially for groups that have been historically marginalized. And so I do that with my company, Just Equity for Health, through education, advocacy, and then designing the way that healthcare is delivered to these populations. So I feel very lucky to get to kind of live this dream where I get to both be a doctor and, work on making the healthcare system a little bit better than it is.
So good. You're just doing a little something, something in New York.
It's a little something.
A little bit, just a little bit. For our listeners, I just wanted to fill them in on how I met you.
Mm-hmm.
We were both selected to be a part of the inaugural cohort for the Highland Project, which is a nonprofit organization that invests in Black women and their legacy and their vision. And Stella and I were part of the first cohort, and that's how our paths crossed. Mm-hmm. It was such a lovely experience, and I love that even though the official programming has wrapped up, that I still get to stay and be connected to my cohort and people like you, and mm-hmm. Such a wonderful opportunity that we got, and I got to meet you.
Yeah, I mean, I feel forever indebted to the Highland Project, to Gabby, its amazing founder, because what is so cool about bringing all of us together is that we live in separate worlds. Like, would my world have intersected with yours, like from the healthcare perspective? I don't think so. And when we all came together, we didn't come together talking about, well, I do this, I do that. We just came together like people. Just chilling and vibing. And honestly, I didn't realize how much of a badass you were until like well into the fellowship, where I was like, wait, she's building what? She runs what? And isn't that what Black women do? They're just amazing all the time, and very, low key about it. And so it's just been a pleasure to have the Highland, as you said, our Highland sisters as part of my community, because I've learned so much from you all.
Yeah, so good. I think you're right. I don't know that our paths would have crossed had it not been for the Highland Project. And I think that we're continuing to see the impact of what Gabby launched, not just through the investment and the work that we're all doing, but also in the relationships, like you said.
Yes.
And that I get to be a part of the sisterhood that I didn't have before, and that we're all over the country. And I can pick up the phone, I can shoot a text, I can send our little group message like, I need my people. I can send out an SOS alert, and you all show up. And so it's been this, for me, a leaning into community in a new way, and being able to build these relationships that I know I can fall into when things are tough, or even in the good times. I have a whole sisterhood that celebrates with me, that cries with me. And even just knowing that I have this sisterhood when I walk into rooms where I'm sometimes the
Yes.
only
Yes.
Black woman in the room, I know that I'm taking you all with me. I'm going to start crying. I'm like, don't cry yet. It's too early in the episode. It's too early in the episode to
No,
start
I
crying,
feel
but it's
you. I
such
feel
a
you. It's nice to
blessing.
be held. How often are we
Mm,
held, right? And the Highland Project holds us. And so it
mm,
does make one emotional. It's a
it
big hug.
does. It's a big hug. It's a big hug. Well, I want to dive a little bit into your journey. Tell us a little bit about your origin story, where you grew up, um, and why you chose to go into medicine. You talked a little bit about your mother being a doctor, a physician, but I'd love to hear a little bit more about your origin story, and I'm sure our listeners would too.
Yeah, sometimes think that my origin story started off real mild-like, and then it became like a villain origin story because some crazy things happened along the way. But, when I was young, as I mentioned, my mom is a pediatrician, and she had a really cool model for the way that she delivered care, and that she chose one of the poorest neighborhoods around us, Far Rockaway, because my family came from Ghana originally, and my mom always felt kind of sad about the brain drain from her country to come over here to serve patients. And so she wanted to serve patients that she felt like looked like her and that, really needed her as a doctor. So when I decided to go into medicine, because I wanted to be just like my mama, I wanted to do, community care medicine. I wanted to be an HIV doctor in the community. And what's so interesting is the ways in which even now, primary care is somewhat discouraged as like a field. I remembered I went to Harvard for undergrad, med school, public health school, and I remembered when I told my advisors that I wanted to do primary care, they were like, "Are you sure? Are you sure you don't want to do a specialty?" And I'm glad that I had the example of my mom to really kind of locate me in that. And, as my career went on, I think I experienced a lot of hardships that Black women, Black physicians, Black patients, right? Like that we encounter, and that our healthcare system, unfortunately, is quite discriminatory. And it has an impact on us in our mental health, our physical health. And so over time, I decided that I wanted to work on healthcare improvement. How do we make the healthcare better? Because it felt like I couldn't really survive as a community doctor, seeing patients 5 days a week. Like I would just burn out and be not the kind of doctor that I wanted to be. And so I was like, man, if that's the setup, then I want to improve this healthcare setting for our patients, and certainly for other healthcare workers like me who were like, at the time kind of naive and just wanted to go be a doctor and, somewhere in the community. So the work that I do now really thinks about those key questions of like, what makes it so that healthcare is unequal for some people? What makes it so that the experience is poor for some people? And how are we addressing those root causes to make it better? Along the way, I worked in a health system that was very, very difficult for me, in part because I had a toxic work environment with a toxic leader. And navigating that as a Black woman again was very, very challenging. You don't have the words, you don't have the example, you're being gaslit, you don't know what's happening. And then I went to work for industry. I worked for a company that translated innovation from industry to frontline staff, like doctors and other people who are working in healthcare. And so I got really great perspectives from that. And I used that to build my company. And my company really, asked the question of what are we doing to improve healthcare for those populations that are historically left behind, and then we're shocked when their health outcomes are worse. And COVID, and everything that happened in COVID was a real moment for us to see in real time. This is what we mean by the built-in inequities, because all of us were exposed to COVID at the same time. Some populations, like Black and Brown people, died at faster rates. All of us have had a decrease in life expectancy, but some people have lost years, over 5 years, whereas others have only lost a year of life expectancy. So this stuff keeps me awake at night, and I want to work on it, and I want to make it better. And that's kind of how I've gotten here.
Wow. A mouthful. So much. I'm like, which direction do I go? Ah, well, do you know first of all, thank you for the work that you do, and for choosing this path and for choosing to lean in when
Hmm.
other people are like, hey, come over here. It's like, no, I
Yeah.
want to do this work. How beautiful it is that you had your mother as a model, as like a guidepost, to kind
Yes.
of be like, actually, this is the work, right?
Yes.
Which
Yes.
is beautiful. We talk about that in the Highland Project legacy, and being able to look at our elders for those examples is so beautiful. You mentioned working in a toxic work
Mm-hmm.
environment. We have seen in the last several months a lot of, not a lot, but I mean, there's a lot, but few have
Mm-hmm.
been in the headlines. Black women being let
Mm-hmm.
go,
Mm-hmm.
being put in positions um, because of 2020 and these
Mm-hmm.
organizations and companies making promises and we're going to do
Mm-hmm.
better and launching DEI programs or ramping up their DEI programs, and only to see, several years later, these women being let go or pressured to resign. Um, I'm just curious around your thoughts on that and from your lens and your POV around your experience in a toxic work culture, and how that impacted your mental health, how that impacted your emotional well-being. Yeah, I just would like to hear a little bit more
Yeah.
about that and your thoughts on that.
I mentioned it as my villain origin story because I think in some ways, if that hadn't happened to me, I would have stayed in academia and been a clinician researcher and kind of just had like a classic, career. And what I experienced was very, very, very kind of similar to what many other individuals experience, where, you're brought in to execute work that you're just undermined to actually do at every turn. And I think about what you've mentioned about the state of DEI and health equity in these big positions. They give people these roles and they set them up to fail. And when they fail, they say, well, why did you fail? Well, I failed because organizationally, y'all folks never wanted to improve and change. And I think that what my experience at this health system gave me that was powerful is that it ripped off my blinders, and it ripped off my sense of, these institutions will protect us and help us. Because when we experienced what we experienced, it was really a group of women that were being systematically discriminated against. And when we experienced what we experienced, we thought, like good girls, that we would go to the institution and tell them, well, our boss is toxic and abusive, and this work environment is problematic, and here's how we can help you fix it. And we did that. And instead of kind of like, well, let's fix it for the better so we can keep people. And the institution also tried to convince us that what had happened hadn't happened. And there were over, I would say, almost 20 individuals that came forward with complaints of issues and problems and real concerns for discrimination in pay inequity, in, just toxic kind of talking to people that have people crying in the hallways, like real things that we weren't imagining, right? And so it's one thing to convince one person, little old Stella, that she's a mess and it's all in her head. It's another thing when you've had people who've run, multinational organizations who worked here, who you're trying to convince are also problematic. So the kind of
Mm,
summation of that is that it woke me up. And once you're
mm,
awake, you can't go back to sleep. Once you see it, you can't
mm,
unsee it. And
mm,
so we are now in a real fight to make this right. We filed a federal lawsuit to really bring these grievances to bear because these big institutions don't have to answer for anything. And we've started an advocacy campaign to improve healthcare, to improve protections for healthcare workers in New York, and
mm,
ultimately nationally. So I took something that was very damaging and soul crushing and could have been career crushing, and I've made it into something that I want to improve around and advocate around.
mm,
And I think, to your question as it relates to what's happened the last few months, I just think these institutions are showing their true colors. 2020 was a really wild time, and I think everyone did want to try to do better, but there wasn't the true commitment. And so over time, that lack of true commitment can be seen. And the experience that's really kind of scarred me and made me so sad is what they did to Claudine Gay at Harvard, my alma
mm,
mater, where I just am so disgusted and
mhm,
disappointed. And
mhm,
I literally had to stop watching the news because I was like, I'm going to punch a wall. Like, how
mhm,
are we in this place,
mhm,
where we've given this woman a platform for 6 months and literally set her up to fail. And then we turn around and we try to convince her that it's her fault and so big breath, deep breath. I would say that,
mhm,
my experience definitely woke me up, and I look around now and I see what's happening and I'm disappointed that this is the direction that we're going in. And I think that we will save ourselves. We were talking about how we have community, we build each other up. no one's going to save us. No one's going to come and help us out because it's the right thing to do, because this country was founded on genocide and enslavement and needs to, offer reparations and make it right. That's not going to happen. And so how do
Mm,
we save ourselves? How do we move forward? How do we improve?
mm,
And those are the things that I kind of think about. But it's not without a sense sometimes of doom and foreboding. Like, is
mm.
it just going to get worse and worse and worse,
Yeah, yeah, yeah. I agree. I mean, that's the reason why I started Exhale,
Yeah.
um, because I knew um, this system is not saving us. It
Mm-mm.
was not designed to um, protect, to invest in the Black community and Brown communities,
Mm-hmm.
right? And watching things play out, as you said, it's disheartening, not surprising.
At all.
Yeah, I was not surprised. I was like, well, we were all kind of watching the clock, like,
Yep.
okay, when's everybody going back to sleep? Y'all got
Yep.
woke up in
Yep.
2020 and it's
Yep.
nap time again. It's nap time, right?
Apparently.
Yeah. So I think that there's something powerful about community care that that we can continue to look at ways to build community and lean into each other. Um, that's literally Exhale was born out of
Mm,
that frustration and that
mm,
aggravation and rage around
mm,
how could some of these mental health and wellness mainstream apps not be
mm.
addressing what Black people are going through right
Yep.
now in 2020. They were saying nothing to our experience.
Hmm.
And that led me to remember how I was raised. I was raised in the Black community. I watched community care happen all around me, neighbors
Yes.
showing up for neighbors, my
Yes.
grandmother showing up for the lady up the street, her
Hmm.
best friend Bourbon. I'm like, what a cool name, by the way.
I was just thinking the same
Her
thing.
best friend's name was Bourbon. She
I
was the
mean, speak it.
coolest. She was so cool. And I think she drank bourbon. But I watched my grandmother show up for her neighbors, and she would keep canned goods underneath her bed in
Mm,
Avon boxes, and she would hear about somebody going through some hard times, and she'd say, "Sissy, get some canned goods out of
mm.
those Avon boxes," and we'd pack up a grocery bag and we'd walk to deliver food to our neighbors.
So beautiful.
Yeah. And, I didn't realize until I got older um, what a lesson that was for me
Yes.
and how deeply rooted my family, my mom and my grandmother was in community. But we grew up I mean, all my neighbors were Black. We went to a community center, the all Black kids playing basketball. Like
Yeah.
it's almost like we gathered together and we were in it together. And
Yes.
there's something really powerful about that I reflected on as I was in a fit of rage around
Hmm.
why aren't these mental wellness apps providing something for us? And I thought, well, they're not they're not thinking about us
Hmm. They don't
because
see us.
they don't have to,
Yes.
right? They're not going through the same things. Therefore, right? They get to turn a blind eye or not even turn a blind eye. They don't even have to see it because they're not experiencing it. And
Yeah.
so I reflected on how my mom and my grandmother showed up, and I was like, oh, this is what we do. We show
Yes.
up for each other. So I was like, well, I'm going to create something for us. I'm going to create the very thing I
That's
was
so
looking for,
beautiful.
And so I think that you're right about we can't wait or hope for folks to come for us or for our government to save us or for,
Hmm.
right.
Hmm.
We're actually seeing, things rolled back, right? Like affirmative
Yes.
action, like rolled back, like things that our ancestors and our, folks marched for, folks
Yeah.
died for, right?
Yeah.
And so I think it's really important for us, for Black women, for Black people, to really lean into each other and lean into community. And how do we really establish community care?
Hmm.
And, everything that's been happening, specifically with Black women leaders, I've been asking that question. My team and I have been talking about that. Like, how do we show up for Claudine Gay? Right?
Right.
How do we
Well, I
show
think
up in that way?
what's so interesting about the story you told of your grandma with, the food under the bed, which I love, is that we've been doing this, right? And so
Yes.
I would say the white supremacy culture kind of teaches us or focuses on the individual, pull yourself up by your bootstraps and kind of you're in it, for yourself, by yourself, that's it.
Mm-hmm.
And I honestly think that it's a return to the principles that we have, right? Like our kind of ancestry and indigenous roots that say like we are a collective, we care for
Yeah.
each other. Everything from I care for this tree because this tree gives me the air, and
Mm-hmm.
we're so transactional
Mm-hmm.
in the ways that we are, the ways that we show up, the ways that we're taught to be. And I just love to kind of think about how do we unlearn this and go back to what we know
Yeah.
in our deepest selves. Because when you were a kid making those walks with your grandma to deliver food, you weren't, kind of like reading about the pedagogy of mutual aid trust. And but you were taking it into yourselves. And
Mm-hmm.
now you show up, literally you showed up at a time where you saw a need for our people and no one was filling it. You showed up. And
Mm-hmm.
I want to just kind of speak to our internal wisdom that I think many of us don't
Mm.
necessarily quiet ourselves to listen to, but it's there. And I think we need to
Mm.
access it because I think that we are going to be our best solutions going forward.
Mm. Internal wisdom. You're so
Hmm.
right. You're so right. Tuning into that and what is that telling us? And how is that leading and guiding us? And that requires us to get still,
Hmm.
right? It requires us to kind of pause. Something that we did quite a bit in our cohorts when our cohort would meet in person was getting still,
Yes.
getting quiet, resting.
My favorite.
We would rest. Boy, I didn't expect that. I was like, oh,
Oh my goodness.
we taking a
Naps.
rest? Nah,
Yes.
I would be knocked out, slobbering. I'm like, oh, I didn't know. I didn't know I was gonna fall asleep. But I think it's important for us to take those pauses and those breaks because then that gives us an opportunity to tune into that internal
Yes.
wisdom, right?
Yes.
Yeah.
Yes.
And it
Yes. I mean,
leads us.
my favorite book of last year was, Rest is Resistance.
Hmm.
And it's just not a message that we get that much. And honestly, I was primed for that book by the work of Highland, by all the
Mm.
work that we'd done with, the Highland team. And when I, had my birthday last year, my partner got me a blanket. And people were like, he got you a blanket for your 40th birthday? I was like, yes, he did, because he'd been listening to me. And what I wanted for myself in this new
Mm.
decade was more rest. I wanted to, lay down with my little blanket, my little designer blanket, and just take a load off. And I don't know about you, but
Yeah.
I feel like the last couple of years, certainly the last few decades of my life, have just been go, go, go,
Hmm.
achieve the next degree, do the next thing, get the next accolade, and
Hmm.
it has been nice to say, like, this can be a time where we embrace rest, and actually, rest can be a way through to the change that we want to see. And certainly, I
Hmm.
think it's powerful to teach the next generation because when I look at, my daughter, I don't want her to hustle and struggle the way that I have.
Hmm.
Yes, the world may be a hot mess by the time that she's an adult, but I want her to know that she is worthy of investing in and resting and caring for
Hmm.
alongside the work that she'll do to make the world a better place. I don't think I quite got that lesson. And so to learn it now in my big old age feels really good.
Hmm. Oh, girl, you got you a blanket. I want me a blanket.
Yes.
Snuggle up, take a nap,
Yes.
take a
Yes.
nap. I
Yes.
love that. As Black women, we have everyday stressors, and those stressors are compounded by systemic racism. This stress weathers our mental and emotional health. It's imperative to move this stress out of our bodies so we can live healthier and happier lives. Exhale app is a resource to partner with you in your well-being journey. To download, go to the App Store and Google Play. Now, let's get back to our episode. Well, you're a new mama. Well, not
Hmm.
fresh, not brand new. You've been doing it for a minute.
I have almost 2 years.
I know. Tell us about that. How has
Well,
that
we
been?
met when I was preggers, right? And so
Mm-hmm.
I walked
Mm-hmm.
into, I think maybe my first Highland meeting, and I was like pregnant.
Mm-hmm.
And you guys all took such good care of me. It was so beautiful. I think the experience of being a mom at this time, the highs are so high. And then I have this existential worry of like, what have I done?
Mm-hmm.
Because I look at the world, and exactly as you've stated, we're seeing a reversal back. We're seeing, reversals like affirmative action, like the Dobbs decision that restricts
Mm-hmm.
reproductive access and rights. We're seeing challenges to our democracy where facts aren't facts and people, don't believe in kind of institutions. We're seeing the rollback of public health supports that keep us safe. I just got a notice in my email before I came on, a New York Department of Health advisory that measles is on the rise. And when we see patients, we have to really consider measles. Measles, okay? Like
Wow.
these are diseases that a few years ago we're talking about near eradication. And now we're talking
Mm,
about the rise. So I list all of these things to say that the world feels a little scary. And I think that this is even before we start talking about the growing conflicts around the world and
mhm,
things like climate change and the reality, of what it's doing to our environment. And so as a mom, when I think about, what's going to happen with my daughter going forward, I wish I could live forever so I could take care of her and protect her. And I know
mm,
that I won't, right? And I think about the world that we are leaving for her and for your
mm,
kids. And
mhm,
honestly, that is what keeps me going because, I mentioned to you earlier that I'm really invested in rest. And a part of me is I watch the way that people are choosing to kind of self-sabotage. A part of me is like, well, then y'all just do you. I'm gonna go over
mhm,
here and just live my best life and rest. And then I look
mhm,
at her face, her cute little face, and I think, I don't want to leave this world less than I found it. I want it to be better because we owe our kids and their offspring and just the earth. We owe them the best versions that we can invest in. And so motherhood has been
mm,
inspiring and it definitely has
mm,
kept me in the fight. Although I take more rest now, it's kept me in the fight for sure.
mm. Yeah, those little people can be such motivation and inspiration for
Yes.
us, right?
Yes. Mm-hmm.
Man, they're the best. They're the best. I know my kids have done the same thing. I just look at
Yeah.
them and want better, which
Yes.
gets me up, gets me,
Yes.
pen to paper. Yeah.
Yes. Yeah. I
Moving
love
one
that.
foot in front of the other. Yeah. You're
Mm-hmm.
such a good mama, Stella.
Thank you.
Oh,
Thank you.
little
I love being a
2-year-old.
mama.
Oh, she's almost two.
She's almost here. She's going to be 21 months this
Oh
month.
my gosh. Didn't I
Yeah.
go fast?
It goes so fast and she's
I
small for her
know.
age, so she looks still like a baby, but
Little.
she
Hmm.
she acts like she's grown. And so she walks into a room where her little shoulders like about to get in it. And you're like, I could blow and you'd fall over. Like, what are you doing? But she's a delight. She's really a delight.
I love that. I love that. Babies, babies, babies make me happy. They're the
Mm-mm,
best.
same.
So I decided last year to launch a survey,
Hmm.
and I called you. I'm like, so I have this thing I want to do, where I wanted to survey Black women about their mental health, their emotional health, their physical health. And I asked you to be an industry contributor to the survey. Um, Tell me why you were willing to partner with me in that way, and why is data like the
Mm-hmm.
State of Self-Care for Black Women report that we conducted so important?
First, I want to say kudos to you and your team because when you called, you were like, I don't have that much time to figure this out.
Yeah.
So, how are we going to do it? And then you pulled it off, which is like
Mm.
literally the definition of who you are. You make
Hmm.
things happen and you make it look so, I wouldn't say easy, but you just make it look like there's joy while you're doing it. And I
Hmm.
love that example from you.
Thank you.
That survey is so important, or those types of inquiries are really important because a lot of what we get, I would say, certainly in like health equity work, I call them water is wet studies. We get these studies that are like hypertension rates are unequal for Black people and white people, like Black people die earlier. And we just keep regurgitating the same data points.
Mm,
Oftentimes, though, we don't get to the source of the why.
mm,
And so when I think about a survey like what you guys conducted, it was really to say, tell us what you're thinking. Tell us where your head's at. What's on your mind so that we can think about how we can take better care of ourselves and each other. And we just don't ask those questions in that way. We certainly don't often ask those questions of certain demographics like Black women. And so
Hmm.
it's powerful. It's so powerful to say, like, this is who I want to hear from. And this is the topic that I want to focus on because I'm
Yeah.
not just doing, which is what we do a lot in academia. We ask questions, we reproduce data that we kind of already knew was there, and then we don't exactly do anything about it, right?
Right.
And I think the work that you did was to say, I want to understand this because I want to work on how we improve the things that are really destroying our self-care habits that we need to build in a world that, as we just described, is getting harder to be in. So
Hmm.
it's invaluable. I hope you continue to share it widely. I hope the people who haven't read it go and read and take a look. And I hope we get to do more inquiries and surveys just like this
Hmm.
because we need to know. And honestly, sometimes it doesn't always feel free to report it, but knowing that it's coming from your team, I think you got a better response rate in part because of that, because people could
Hmm.
tell, like, these people actually want to understand where I am, right? So kudos to you and kudos to the team. And I'm glad that I got to be a very small part of it.
Oh, thank you. Thank you for being an industry contributor for the
I love
survey.
it.
Yeah, we've gotten some great response. I think, initially I wanted to do some research, right? Like around like how can we make the app better? So market
Hmm.
research, let's ask
Hmm.
Black women. We're creating a resource for Black women. Well, let's ask them what their experience is
Absolutely.
like. And then it turned into with your help and with the analytics team that we partnered with, it turned into something more robust
Mm,
that dove a little bit deeper, that produced results that we can share not just with our community, which
mm,
is what we're doing, but also to call in non-people of color and say,
mm.
hey, this is what Black women are saying
Yeah,
about their workplaces,
yeah.
about the way in which they're forced to weave through life in their bodies,
Mm,
um, when they feel safe, when they don't feel safe with
mm-hmm,
a provider,
mm-hmm,
a physician, a doctor, a medical provider. And so it turned into more that we can
mm.
say, hey, here's what Black women are saying. They're part of your companies, your organizations, your institutions. How are you going to do better and
Yes, yes.
provide wraparound support as you put that woman in a leadership position? How are
Mm-hmm,
you going to provide resources that are tailored to her specific needs, to their specific needs?
mm-hmm,
And so it's been really interesting to watch the unfolding of, since that first phone call that we had and we kind of
mm-hmm.
hashed out some of the survey questions and the purpose and kind of broke it into those buckets and um, into like it went out, people responded,
And
and
its
we're
impact.
able to collect that data that it's now turned into more than what we originally expected. And so it's been a really powerful tool for us to use, not just to better build resources as a team and as a company through Exhale, but also calling other folks in to say, hey,
Yeah,
this is what Black women are saying. We ain't
I
making this
love
up.
that.
Like
I
they said
love
this,
that.
and it wasn't two
Yeah,
or 10 or 50. We surveyed 1,005 women,
yeah.
Black
Yep,
women,
yep.
from all different demographics, different ages, and this is what they're saying. So,
I mean, you have
yeah.
to keep the pressure on some of these
Mm-hmm.
institutions next to like do
Mm-hmm.
something. And so I think
Mm-hmm.
having these data is
Yeah.
step one. So I'm so glad that you were able to make this happen.
Yeah. Thank you. So we did survey over 1,000 Black women, and of those surveyed, there's a strong desire among those surveyed for the creation of more well-being tools and
Hmm.
resources specifically tailored for Black women's needs.
Hmm.
How would a resource like Exhale impact the people that you serve, women that you serve? Yeah.
I just sat with a patient recently who is going through some really tough life experiences where her mom has passed away. She's on her own and she's taking care of her family, her son, who she's having a hard time with. And she has like no resources and no way to think about getting through this time. And she doesn't want to see a mental health specialist because she feels like a lot of them are white and they don't really understand kind of what she's going through. And she's done that before and it hasn't really helped. And
Mm,
she said to me, she was like, Doc, sometimes I just sit in my room and I just kind of like talk to myself. And I just had this feeling of like, I wish we had some way to wrap around you, to be there for you, to kind of just let you know that you're not alone,
mhm,
and I feel like, the Exhale app and things like it, and just like our approach to mental health for Black women, one meets them where they are and lets them feel seen. Because that's what this person was saying to me is I don't feel
mm,
seen enough to like
mhm,
use the resources that are available to me. And
mhm,
so for me, what it would mean to do this work well is to one, acknowledge our importance, and two, let us feel seen, and then three, meet us where we are. Literally
mhm,
provide the service on our phones, in our, and I just think that there's such a need for that at this time because people are really mentally beaten down. This
mhm,
pandemic did a number on us and it's kind of like still going, people lost loved ones that they're still dealing with. And everything that we've mentioned is happening, with politics and the reversal of important
mhm,
policies, et cetera. So we're in an environment where people, I think, are isolating and are scared and don't know how to ask for help. And I
mhm,
think that the mechanism that you've used to offer this help for the group, of Black women that I think often carries everything on their shoulders is so important. And so I
mhm.
think about this patient right away of like, these are the people who really need things like that.
Yeah.
In addition to all of us, who are professionals and highly functional,
Mhm,
like
mhm,
I
mhm,
certainly, just like, my patient, could use a space and places and resources that just let me feel seen and allow me to have a pause, a moment of pause. And even better, give me some ways to invest in rest and self-care. So the
mhm.
need is just there so incredibly. And I think the mechanism is what we're figuring out.
Yeah, absolutely. I mean, that's why I wanted it. I wanted Excel to be an app because I'm like,
Yeah.
well, phones have become like another limb, right?
Yeah. Yeah.
If we leave it at home, we're going back for it,
You're going back.
right? It's
Yes.
like, I forgot my phone, I forgot my phone, right? And most people have phones. And so I wanted it to be something that you could just immediately turn to. Um, Through the survey, we learned that Black women don't have 30, 40 minutes to sit and listen to a
Hmm.
meditation or breath work or spend in a wellness app.
Hmm.
That they have 5, 10, or tops 15 minutes that they're
Hmm.
spending or that they would
Hmm.
spend. So much like we experience microaggressions, we have micro self-care.
Yeah.
So snippets of like a five
I
minute,
love that.
a 10 minute, a 15 minute. Yeah. I didn't have language for that until I was with Rhonda,
Mm.
our other Highland sister.
Yeah.
And she had heard that somewhere. She heard someone talk about micro self-care and how
Yeah.
we have to take those
I'm
because
gonna write
sometimes
that
it feels
down.
really overwhelming, right? When we think
Yeah.
about self-care or taking care of ourselves. It's
Hmm.
like, it feels like this huge mountain we have to climb or lots of time that we have to carve out. And
Yes.
when she said that, I was like, oh my gosh, that's what we're doing. And
Yes.
so we've adopted that language to be able to say it's micro self-care. We experience microaggressions. We have these moments where we just need to take a pause, like you said.
Yeah. Yeah.
Um, and that doesn't have to be 40 minutes or 30 minutes. It can be
Yeah.
10 minutes. It can be 15 minutes. So we with the new version of the app, we instituted that. And so there's those micro options to be able to take a moment
Mm.
for self-care. And it doesn't have to be a really long time. But if we can start a kind of creating a new rhythm in our lives, our everyday to do that, um, it builds our capacity to go into a world
Yes.
that's hard, right? It
Yeah.
helps us to manage those hard, tough, overwhelming emotions that come up. Um, and so, yeah, so we were able to do that. So, yeah,
I love
we need to
that.
get your patient a subscription.
Yeah,
Well,
seriously.
offline, I have some, we'll donate. We'll
I
get her
mean,
one.
it's I just want to say that, as like a person in the world, the way you just described that really speaks to me because
Hmm.
every day I finish my day and I feel like I wish I had more time. I wish I could do more. I wish. So when
Mhm.
someone talks to me about, even like something like going to exercise for an hour, I just feel like with what time? So
Mhm.
just this feeling, you just made me feel like the work of self-care was really accessible. And I really
Hmm.
appreciate that
Oh,
because
good.
sometimes it feels like it's another thing to do that's
Hmm.
hard. And I don't
Hmm.
want things that are hard. I want more ease. So
Absolutely.
thank you for
Absolutely.
like designing that element into it.
Yeah, absolutely. I'm curious around what are some of your self-care practices?
Yeah.
And before that, like how would you define self-care? That's something that I'm really curious around listening to Black women. I think
Mm.
that when we look at what the wellness industry, it's very white
And
and
packaged.
white and packaged and white centered. And we're looking to say, okay, well, how could I do need to take care of myself and I need to practice self-care. But when we look out there, it's usually produced and it's white people,
Mm-hmm.
whiteness, which can
Mm-hmm.
be harmful for
Mm-hmm.
us. So
Mm-hmm.
I've been curious around our definitions of self-care as a Black community and how do we define that? Um, Much like the work we did at the Highland Project with
Yeah.
defining wealth, like it looks different for us.
Yeah.
So, how would you define self-care and maybe give us, a little peek into some of your self-care
It's
practices?
such a great question. And it's a question that I don't think we get asked enough.
Mm,
And as I was listening to you talk, I was thinking, I certainly did. The things that I'm told are self-care don't necessarily resonate with me in part because of the kind of cultural frame, but also it
mhm.
just isn't what I feel like I need. Like, I was just thinking about like someone dressed in like Lululemon, doing like 4 hours of yoga or like bubble baths with candles. Like it sounds lovely, but it doesn't feel first accessible to me and it doesn't feel like what I need.
Right.
When I think about self-care, I go through a lot of my days and I feel depleted by the end of the day. And so self-care for me are all the activities and moments and things that I can do that fill me up and
Mm,
that make me feel like I am not being depleted. So I hate to describe it kind of in a
mhm.
deficiency way, but
No.
if my days kind of lead me as a doctor, as a mom, as a partner, as a friend to feeling like, whew, I don't have a lot to give, self-care kind of fills that bucket a little bit. And so
Mm,
what it looks like for me, I love to read. And so it's sitting and getting to read. And I'll read trashy things like
mm.
crime novels and
Oh,
it's not
yeah.
highbrow reading, but it's time for my mind to kind of
Yeah.
stop thinking. And so it's reading. It's I have tried to be better with my journaling practice, but I think journaling sometimes is sitting with myself, which can feel really rejuvenating and good. And so I would say journaling is part of that. I love taking walks, and I don't get to do them that often, but when I'm able to be in nature and take like a long walk, often like without my headphones, just kind of going,
Hmm.
that is absolutely my self-care practice. Um, and I would say part of my self-care too, especially now because I don't get to see my loved ones quite as much, is spending time with my friends and
Hmm.
kikiing it up and just, kind of like letting my hair down for a moment where I'm not anyone's mom, I'm not anyone's doctor, I'm not, an entrepreneur. I am just like Stella, just, being me. And
Hmm.
I think what's hard about all of those is like, where is the time, like where is the time for me
Hmm.
to journal,
Hmm.
to go for a long walk, to read,
Hmm.
to go see a girlfriend and just like, take a load off. But those are all self-care for me because they fill me up.
So good. I love that. Thank you for sharing
My
that. It brings
pleasure.
up in me when you talk about depletion. I think that that's common
Hmm.
and specifically in Black women, right? Because the world is pulling and taking and has historically done that to
Yes.
Black women. I'm a coach and I coach Black women
Hmm.
one on one and in group settings. And my clients crack up. They laugh at me all the time, but I'm like, I use the analogy of I mean, what really happened with our ancestors is they were breastfeeding
Mm-hmm.
their masters, slave
Children.
owners,
Mm-hmm.
babies,
Yeah.
right? And so that's kind of been baked in to
Mm.
our, you know, the ways in which we show up, right? Is
Yeah.
just
Yeah.
giving, giving,
Yeah.
giving, giving. And so I'll tell my clients, I'm like, put your teat back in your shirt. Stop it. Stop it. You don't have to do
Yes.
that. You don't have to do that.
Yes.
Because I think our nature is to like lean in, give, show up, show up, show up, show up, show up, and then we're depleted, like you said.
Completely.
And it does, I mean, we have to work, we have to show up for our family, our babies, right? Like those are like, we can't not do that. But what are ways, as I challenge my clients, what are ways that you're whipping out that tea that you
Mm-hmm.
really don't need to?
Mm-hmm.
Right? Like
Mm-hmm.
you really put that back in your shirt, right? Like think about those. So I really encourage my clients and encouraging the listeners now and you, Stella, and myself to think about that because it's almost innate for us to give and give. And also for just even baked into our culture to take
Mm-hmm.
from us, to
Mm-hmm.
take. I mean,
Mm-hmm.
I'll just be just wherever, I don't know, like having dinner with a group of people and all of a sudden people are asking me, what do you think about this? And can you help me with this? And what's your
Mm-hmm.
thoughts on this? And I'm like, oh my gosh, it just happens specifically when it's not my community. I'm like,
Right.
oh, no,
Why am I
no,
always the
no.
worker bee? Mm-hmm.
Yeah, no, no, no. You can't. No, we're gonna. So I put that analogy in my clients' heads. I'm like, think about ways that you can not pull your teeth out.
I love that. I love that because it's so graphic, right? It makes you really pause. You're like, she said what? But
Hmm.
yeah, sometimes we need that to kind of
Yeah.
pause us from saying yes, or of course I'll do it. Or, there's that
Hmm.
phrase of if you want something done, ask someone who's busy.
Hmm.
And I feel like oftentimes we're punished for our competence. We're punished for the fact that we
Mm.
get stuff done and we're good at it and we make it look easy, right? Like I played around with like, and sometimes men do this where you'll ask them to do something and they're like, how do I do it? I don't understand. And
Hmm.
so then over time you just stop asking them.
Hmm.
But I played with like, should we make it look harder?
Yeah. Like, I
Like
don't know. It's
you
really
know what I
hard.
mean?
Yeah.
Like,
Yeah.
because it's just
Yeah.
like, wow, why would you? And oftentimes you're asked to do these things with no compensation, as though your time
Exactly.
and your brilliance and your expertise isn't worthy. In
Hmm.
most of the spaces that I move, if I can, especially if I'm working with big institutions, I always say, how will we compensate people for their time? It's
Absolutely.
so important. The power imbalance is just so much at
Hmm.
play. So
Hmm.
anyway, I love that. I think you are
Hmm.
brilliant for that. And when you write your book and books, I hope you put that in there.
I'll put that in there. Keep your
Yes.
teeth in your shirt.
Yes.
Because I mean, our ancestors literally wouldn't
That's what we were
have
built on.
potentially enough milk for their own,
Yes. Yes.
right? Enough
Yes.
food to feed their own babies because they were
Yes.
giving it to somebody else. So
Yes.
that's the like, oh shit.
Mm-hmm.
In what ways am I depleting? I'm not giving back to me or reserving enough for me and mine
Right.
and thinking about self-care in that way,
Yeah.
right? Hold on
Yeah.
a second. Like you can't take all that from me. Like I
You
need
cannot.
I need care. Like I
Yeah.
need invested in. I need to get my blanket and rest. I need to curl up with my babies, right?
Mm-hmm.
And
Mm-hmm.
so I think that kind of shifting that a little bit may help us to define not just define self-care, but find time.
Yes.
I
Yes.
think if we
Yes.
think about it that way, it'll carve out some time. It's like, oh,
Yeah. It's like,
actually,
who
I
am
do
I?
have time if I don't get my teeth
Yeah.
out for
If I
you.
don't give my time to you for this BS thing, I actually will have the time to do the thing that fills me up. You know what? It's a
Exactly.
great framing. I'm taking so
Yeah.
many notes. Micro
Yay.
self-care and keep your teeth in your shirt. Yes.
Keep your teeth in the shirt.
Yep.
Oh, this was so fun. I'm so glad we got to chat.
Me too.
If our listeners want to keep up with you, want to find out more about Just Equity, your work, yeah,
Yeah.
where would they find you? How do they keep tabs on Stella?
Yeah, you can go into most of the social media apps, just put in Stella Safo and you'll find me. Same thing for Just Equity for Health, which is the business facing portion of my work. And our website is justequityforhealth.com. And you can find a lot of information of what we've done there, like keynotes, some of the educational materials that we create, and opportunities to partner to do this work. So I invite you to look us up and to follow up with us.
Awesome. Thank you so much for your time today. What a treat.
Thank you, Katara. This was so fun.
All right, listeners, check out Stella. And don't forget, be sure to exhale. Until next time.
Exhale is a social movement prioritizing the overall well-being of Black women. You can join our movement by subscribing to this podcast and downloading Exhale app, and by continuing to prioritize yourself and your well-being. Keep taking deep inhales and long, long exhales. Until next time.